Hi, my name's Dr. Mike Lloyd and I'm a consultant clinical psychologist. So I specialise in complex trauma and dissociation, which means working with people in a great level of detail, often for long periods of time, looking at past experiences, the trauma that they've experienced throughout childhood, adolescence and into adulthood, and trying to kind of decode and help people recover from the dissociative responses protecting them from that trauma. Now, a lot of our work traditionally was always done face-to-face in therapy rooms, one-to-one with those patients over long periods of time, as I said. So it could be 1, 2 or 3 years. And this was fine, and this was exactly what we were doing a lot of the time until COVID happened, and then necessarily things moved on to online therapies. Actually, what we've noticed is there's been an increase in people looking for therapies following COVID, and this the emergence of online therapy is a much more common and popular tool to use than ever before. So previously I may have been seeing 1 or 2 patients through online systems, and now I can maybe half my caseload or 3/4 of my caseload had ended up being online. So I wanted to just talk today about the pros and cons, or some of them, of working with online therapies as opposed to face-to-face therapies. So this isn't an exhaustive list, and this is not necessarily just about people working with complex trauma and dissociation. I think this could reasonably apply to pretty much anybody seeking help for mental health therapies from any type of practitioner. So I'll start with the cons, because I think it's always a good idea to get the worst bits as such out of the way, and then we finish on a positive note. So here we go. So there's 3 cons and there's 3 pros. Like I said, this is not an exhaustive list, but these are sort of key ones that have been identified to us, fed back to us within our clinic over the last few years since COVID. The first con, or the first sort of negative as such with online therapies, is the absence of seeing the whole person. So obviously we're just seeing this, we're seeing the head and shoulders, and there may be some hands gesticulating. So we lose that sort of sense of the entire person. And a lot of trauma therapies are somatic in nature, which means they are body orientated therapies, or where the trauma is held within some aspect of the body, and there could be stiffness, or there could be spasms, or there could be jerks, numbness, pains, all these different things. And it's kind of difficult, obviously, if you've only got a small aspect of the person, to be able to see exactly what is going on with that person in terms of that therapeutic moment in time. The second one is that it's just harder to use the room to help ground people. So when people become either dissociative or highly anxious or really stressed out or panicky, often in therapy what we do is we utilize the resources that we've carefully located throughout the room in order to help the person become grounded, centered, in a way of making them calmer and be able to regain their executive thinking control and regain the management of that session. And you can see in the room behind me that there's lots of bits and pieces dotted all over the place. These are not random objects, these are specifically located objects designed to try and get the attention of the person and used to help with that person. If we're working with online, we don't have access to any of that stuff. I can't pick up an object in this room, show it to a person and go use that as a grounding object. So we need to ask questions and really understand what's going on with that person in their own house. And this is exactly what I would do. I'd really get a sense of the person to describe their room, to describe the layout, to help me understand what their grounding objects may be, and to ensure that in advance of clinical sessions that those are available for that patient. So if need be, if they require some grounding, I can remind them where they need to go in their own room in order to utilize that. So we just have to do an extra level of sort of checking out and making sure that certain things are present. And then the last one is that, sometimes people panic, or they get really stressed out, or they might get angry, or they may dissociate and they leave the screen. So you can just get up and walk away. And sometimes we're told that that's going to happen, that's fine, but other times it just happens. It's not particularly common, but it does happen. And a person can just leave the screen, or they can turn the camera off and they can turn the audio off because they're getting upset or they're getting distressed. And obviously we've got absolutely no idea what's going on for that patient in time. And that can be a concern or a worry. And and each therapist then has to work out a plan of how to identify that, how to deal with it, how to continue communicating, how to ensure that that patient remains safe, given that you can't actually see them. And there's a load of different techniques by which we would adopt that. And again, every therapist is going to do different things. So within our service, we have a number of safety protocols that we would utilize. So if the person leaves the screen, then we run through these protocols to make sure that they're safe and that we can be reassured that all is actually okay. So those are some of the difficulties. You can see that, how they would apply pretty much to any circumstance, any situation. Some are going to happen much more than others. Some might not really feature as a problem at all, and some might be incredibly difficult, all dependent on the individual circumstances. But that's kind of the bad news. And there are lots and lots of pluses to this. There are the real positives to online therapies. So I'm going to go through 3 of these just to help people understand exactly why we quite like working online, and why it works quite effectively for people, even though I don't think it's going to be as good as the face-to-face stuff. It is pretty good actually on its own. The first one is pretty obvious, I suppose. It really does make therapy a lot more flexible. So the time of day, whether it's evenings, weekends, whatever it might be, often is a lot more flexible for online because it fits in with people's lives. And there are less cancellations. So a lot of reasons people cancel is for sort of minor injuries or minor ailments, coughs, colds, or car's broken down, or it's in the MOT, or whatever it may be. There's loads of reasons why people don't attend their face-to-face appointments, and all of those pretty much can be nullified through online systems. So and this is all from patient feedback, that a lot of people tell us that they're much more likely to attend their appointments if they're online, because it just makes it so much simpler for them to get there. Which kind of moves into the second reason, is that the cost is a big deal. Because actually for some people, getting to a therapist, and bear in mind that sometimes people have to make quite long journeys. We have people coming to the clinic from up to 2 hours away. So those are really quite significant journeys. On things like public transport, they're going to be likely very impossible for people to attend, or just the high costs of petrol, parking, depending where you need to be, all of those kind of things. And the absolute time it takes to get all the way to the therapy appointment, have the therapy appointment, get all the way home. For some people, that might be the best part of a day. So having a situation where you can sit down and have the therapy done online without almost any cost whatsoever, because the Zoom systems, all that kind of stuff, they are paid for by the therapist, by the service. All the patient has to do is follow the link, jump on, the session is there, job done, it doesn't cost them anything. So obviously they're paying for the therapy session, but all the additional costs aren't there, which actually makes therapy for a lot of people a lot more affordable. And the last reason is a much more kind of detailed individual one. And this is about what it's like to actually be in therapy with a therapist. So a lot of folks talk about the shame and the guilt and the awfulness of what they feel about the stuff that they've gone through, especially when we're dealing with extreme levels of trauma. People find it often very, very difficult just to describe how they feel and describe the events that have happened to them to a person in a room face to face. They then got to get home, get in their car, or get on the bus, or wherever it may be, loaded up with all of those feelings, and that can be incredibly shameful and incredibly painful for them to do. And a lot of folks have said to us that actually online it kind of creates a distance between them and the therapist, which allows them to be a lot more relaxed and a lot more at ease when describing and sharing their trauma. They can also turn off the screen, they can turn off audio, they can resort to chat, so they can type things that are too difficult to say, and the level of communication can feel a little bit more indirect, which is of great settle to a lot of people. So obviously that last one wouldn't apply to everybody, because some people may find it a lot more hard to speak into a camera. But actually what we found is a lot of people say when it comes to the really difficult trauma stuff, sometimes, and this has happened within our service, people have opted to, instead of have the face-to-face sessions, move on to online sessions for a brief period of time to allow them to kind of go through their traumatic experiences with a bit of distance between them and the therapist, which just sort of eases their way of being able to communicate that. And we respect that, and we work with that, and we can have sort of hybrid and flexible systems between face-to-face and online. There we have it then. So there are sort of 3 sort of positives and 3 potential negatives. A lot of it involves around time and the availability, the flexibility, the costs, how likely a person is to cancel or not attend a session, how likely that they are to be able to describe things and be able to demonstrate in an observable way exactly how they feel, and how safe they may be away from that therapy session when they're on their own in their own accommodation, and they may leave the screen or difficult things are happening and the therapist can't really just sort of help in that space. So there are some risks attached to things, there are some difficulties, but there are some real elements that make it a lot more workable for people. I think one of the most beautiful things is that for a lot of people, accessing a therapist, finding a therapist is incredibly difficult. And if you are limited in transport, really pretty much all you've got is your local village or local town or wherever it may be that you can access therapy to in a convenient way with a specialist perhaps that you may need. And actually the online things means that distance no longer becomes a consideration, and people can sort of find therapists miles and miles and miles away in different cities, in different parts of the country. They can access the help they need in a lot simpler way. And regardless of whether we look at face-to-face or online being better or worse than another, online is always going to be better than not being able to access a therapist because they are just too far away. So if a person has to travel 200 miles for therapy, they're probably not going to do it. If they can go online and have it immediate and right there, then they are much more likely to do it. So the outcome is always going to be better than not having it at all. So I hope that's been helpful. Be really interested to listen to the comments and see what you think about this, and how it may apply to sort of different conditions, or how it may apply to different aspects of mental health, because there are going to be elements where face-to-face is going to be absolutely necessary no matter what, and then that's just that. Obviously, this doesn't really apply to those sort of conditions, where medication is needed or blood tests are needed and things like that. So for the purpose of psychological therapies in the way that we work, I hope that this list has been interesting, and I really would be keen to find out what other people think their additional pros and cons may be to online therapies. So in the meantime, please do all the liking, subscribing to the channel for more content as we go along. And in between now and the next video, as always, please do take great care.